makes me dream. Your eyes light up my world. You're my gleaming sunshine. You are my fairy tale. You make me feel complete.
The first touch, first gush of warmth, first hint of smile, the most precious feeling one can experience. But what if sadness prevails and the chances of spontaneous parenthood become a distant dream for the couple? One tends to hope against hope. Wait for a miracle. Set up in early 2006, Genome is a one-stop fertility clinic within the Bhagirathi Neotia Woman and Child Care Center that takes care of fertility problems due to both male and female factors. It has both diagnostic and therapeutic facilities under one roof, while preserving the privacy and dignity of every patient. At Genome, we specialize in treating infertility from the simplest to the most advanced cases. The clinic takes pride in its team of infertility specialists who are trained overseas. With its international standard clinical protocol in the last 4 years, Genome has taken care of above 5,000 infertility cases. Infertility is always difficult to come to terms with, and the shock and disbelief is enormous. Long cherished dreams are shattered, added to the unbearable social stigma it incurs.
I wish I could help you take your first steps. I feel so empty. There's so much darkness, my little one. I long for you.
Ovulatory dysfunction is one of the most frequent cases of female infertility. This is related to the monthly release of eggs. Tubal infertility, surgical infertility, hormonal infertility, or immunological infertility might be the other causes. Genome has an answer to all these problems. Genome undertakes counseling of its patients into opting for specialized treatments like ovulation induction, artificial insemination, assisted zona hatching, electroejaculation, etc. Genome also specializes in assisted conception procedures such as IUI, IVF and ICSI. Genome has a team of passionate, dedicated and internationally acclaimed professionals who are best equipped in handling infertility and execution of these complex procedures. IUI or intrauterine insemination is the process by which sperm is placed in the woman's uterus. It is done by using a fine plastic tube which is passed through the cervix into the uterus.
Intrauterine insemination or artificial insemination, which it is commonly called, is a procedure in which a washed and prepared semen sample is pushed directly through the cervix inside the woman's uterus. The IUI cycle begins on the second day of the menstrual period. The patient comes to us on the second day, in which we do a transvaginal scan and do some hormonal tests that are required. From the third day of the cycle, we begin the ovulation induction, which carries on and within an interval of say around 2 to 3 days gap, we call the patient back for folliculometry, in which we follow up the growth of the egg from day to day. Once the egg is of mature size, which would be around 18 to 20 millimeters, then we usually do the ovulation kit test, which predicts the time of ovulation, so that we can time the IUI accordingly. In Genome, we do about 80 to 100 cases of IUI every month and have a good success rate in that. We strive harder, we work harder day to day, the whole of Genome team, so that we can achieve more and more success in every month that follows. And our dream is just to fulfill the wishes of all the patients, infertile patients who come to us for our help.
IVF or in vitro fertilization means fertilization conducted outside the body. In vitro literally means in glass, that is, a laboratory dish or a test tube. This is where the procedure happens. IVF is mainly used for cases of infertility caused by blocked fallopian tubes or unexplained infertility.
IVF ET is in vitro fertilization and embryo transfer. The IVF program essentially comprises of 3 parts. In the first part, the lady, that is the woman, is given medicines to make sure that her hormones are regulated properly. After 10 or 12 days of injection, usually the lady's eggs are ready. Then she is taken up for what is known as OPU or ovum pickup. This is a short surgical process where we put the lady under small anesthesia. She is taken to the ovum retrieval room. Eggs are taken out through transvaginal ultrasound. There is no cut or incision in her body. These eggs are then immediately transferred to the laboratory. In the lab, the embryologist scans for good eggs and puts the eggs and the husband's sperms together to form what are known as embryos. The third part is the embryo transfer. This is the most important and the most sensitive part of an IVF cycle. Once the pre-embryos have formed in the lab, the embryologist checks for the good ones, which are the great growing ones and looking good. These embryos, after 48 to 72 hours of incubation, and are then selected and put into a thin rubber catheter, which is then put into the lady's womb to transfer the embryos back to her womb. And after 15 days, we can confirm if she is pregnant and if she is carrying how many pregnancies. We offer laparoscopy, diagnostic and complete IVF facilities under the one roof. This, I think, helps the patients because they don't have to run from one place to another.
ICSI or intracytoplasmic sperm injection is a technique which involves injecting a single sperm directly into the center of the egg. This is performed under a microscope using a very fine needle. ICSI is used when there is a severe male factor problem.
ICSI is intracytoplasmic sperm injection. We are doing ICSI in Genome for last 5 years. ICSI we are doing mainly for the patients where the husband's semen count is really poor. The patient is severe oligospermia. The motile count of semen is like less than 5 million per ml. And also patients diagnosed to have severe oligoacinoteratospermia. In patients who are azoospermic, we are with obstetric azoospermia patients, we are doing ICSI, that is for retrieving the sperm through TISA. And also in patients where patients are underwent previous IVF where the fertilization failure has been taking place. So in those cases, we are doing ICSI in our center. Following ovum pickup, the oocytes will be kept into the incubator and then they will be taken out for the denudation. Following the denudation process, the semen which has been collected from the husband will be injected directly into the oocyte through a very fine injection needle.
There is a common perception of associating infertility only with women. but very few actually know that nearly 7.5 to 10% of all men in the reproductive age group are infertile. These problems in men can be due to blockages in sperm-carrying tubes, sperm disorders, hormonal imbalances, genetic disorder, testicular injury, or disease. Genome has a dedicated andrology clinic looking after male infertility. Medical treatments like using drugs to improve seminal quality, modern microsurgical techniques and efforts in the reproductive laboratory to improve semen quality to facilitate the penetration of sperm into the ovum are successfully executed at Genome. Newer avenues of treatment options are being explored and tested here. The childcare center of this hospital is specially equipped to deal with any and every kind of birth-related problems. Luxurious suites, deluxe rooms, single and twin sharing rooms are available for the mother and child for post-delivery situations. They are kept under 24-hour personalized care. The neonatal care units at BNWCCC for babies 0 to 28 days from birth are adept at taking care of all types of intensive care issues of the newborns. Genome, with its brilliant team of infertility consultants, dedicated in-house staff, state-of-the-art facilities and convenient location on Park Street, the heart of Metro City Kolkata, is well equipped to offer world-class services. Having a success rate comparable to international standards, and all this at a surprisingly affordable cost. Patients flock in from all parts of the globe to make their eternal desire for a baby come true. Genome, where life begins.